Hello, hello. So I'm sure that you've all been anxiously awaiting with bated breath my tips and tricks on providing telehealth in the age of COVID-19. So here we go. For this, I did decide to use Zoom instead of just doing IG stories. One, so that you can have this as a resource to kind of come back to or share it with people if you do find it useful. And two, so that you can see a little bit what this might look like if you are using it for telehealth visits. So Zoom is actually the platform that my work uses. So this is kind of what it would look like if you were on with a patient, except that the patient would be the big screen and there'd be like a little small screen with you up in the corner or down at the bottom. So that's a little bit different, but just to also kind of have it be like we're doing a telehealth visit right now. So just to get started, who am I? For those of you who don't know me, my name is Rachel Griffin. I am a psychiatric nurse practitioner, and I have a mix of both in-person and telehealth as part of my regular practice. So this is something that I'm already fairly familiar with and do on a weekly basis with several of my patients, both in-home and clinic to clinic. So hopefully some of the things that I've learned along the way will be useful for you today. I wanted to make sure that you knew all of my credentials because I'm obnoxious like that. No, I've always joked that I wanted to put them all on a business card, and I have not yet been able to do that. So for your viewing pleasure and my own amusement. So let's get started. Help, my practice has gone entirely remote overnight. So again, while we already have this as part of our regular practice, my office, like many others, has switched over to being entirely remote due to COVID-19 so that we can all stay the fuck home and flatten the curve. Come on, people. I do have one clinic in the hospital that is still open because of needing to provide other types of outpatient care that can't be done entirely remotely. But even that clinic, which does a mix of psych and mostly medical care, has switched over as many patients to virtual visits as possible. So some things to consider along the way. First of all, what equipment do you use? So when I do this at my office, I have a desktop computer that has 2 monitors. I highly recommend, if you have it as an option, if you're doing this from home and you're using your laptop, if you can get a second monitor. If you have a desktop computer, that may be a little bit easier to navigate. But I really like having the second monitor because it allows me to have Zoom up on one screen like this, and then I can have the patient's chart or other things that I need to have access to up on the second screen. And that really just makes things a little bit easier. Obviously, you also need to have a webcam and you need to have a working microphone. And you need to know what are you actually using software-wise for your teleconferencing. So again, this is Zoom, which is HIPAA compliant, which is one of the reasons that we use it. I'll get down to rules and regulations around that in a little bit because they are rapidly changing in response to COVID-19. And some of the things that would usually be a consideration are less of a consideration at this time. So figuring out if you are not in private practice, if you're part of a clinic, your clinic just needs to make sure that you are having discussions around some of the logistics. So how is scheduling being done? How are you communicating with patients? How are you collecting payment? How are you getting consent from patients? As well as safety planning, which in psychiatry, obviously, we always want to know, like, what's the plan if you're seeing a patient in their home and you're really concerned about them being suicidal? So that's something to have a discussion around. Usually, a lot of times it can mean sending 911 to their house. So that's kind of the most obvious possible option. But just make sure that that's something that you and your team have really thought through. Typically, telehealth requires a separate signed consent. Right now, a lot of places are allowing you to just get a verbal consent from patients. Obviously, there's also kind of an implied consent. Like if you are seeing a patient in this format and they are participating in it, they are consenting to treatment. But it is just something else to take into consideration. Some of the rules and regulations. So as I said, these are rapidly changing right now. So with regards to HIPAA, typically it is a requirement that if you're doing telehealth that you have a HIPAA compliant teleconferencing, I don't know the word I'm looking for, software. So we use Zoom, the paid version, not the free version. There's others out there that have those privacy things built in. However, right now the federal government have said that they're really not going to be pursuing any sort of action around privacy violations in that regard. So if you need to use Skype or FaceTime or Google Hangouts, you can do that at this time. But certainly pay attention to those federal guidelines. And just think about if you're going to be using telehealth moving forward after this, that may go back, that may change. So make sure that you have a plan in place once COVID-19 hopefully dies down. If you do decide to keep using telehealth in your practice, that you're using HIPAA compliant technology. You also want to think about billing. So this is another thing that is rapidly changing. It used to be that Medicare did not allow you to do mental health via telehealth except under certain conditions, which I won't get into, but they have waived a lot of that right now, and Medicare is allowing for in-home telehealth at this time. So that's something that has changed. That can also vary from state to state, but because Medicare is federally regulated, those are the current guidelines. There's also typically some regulations around prescribing that are also being waived at this time. So under the Ryan-Haidt Act, you are not supposed to prescribe any sort of scheduled medications if you have not done an in-person assessment. However, they are also waiving those requirements right now and allowing you to prescribe all controlled substances via telehealth, obviously with appropriate documentation and assessment in this way. Something to know, just again, if things go back to quote normal later on, if you have seen a patient in person in the last 24 months and done an in-person assessment, then you can prescribe controlled substances over telehealth. But if you're meeting them solely over telehealth, you're not supposed to. And another thing to really just make sure that you're planning for is for technology failure. This can be one of the most frustrating things about doing telehealth is when either the internet isn't working or the teleconferencing platform isn't working or something like that is going on. So you just need to make sure you have a backup plan. Like, do you call the patient? What are you going to do if this goes down? And you need to be able to contact the patient. One, it can be really disruptive and frustrating. And then two, obviously in mental health, we really want to make sure that we're trying to maintain our therapeutic alliance. And when technology fails, it can be one of the things that can interfere with that and just interfere with how we're doing. And there may be more of that going on right now since literally the entire world is attempting to do their work remotely at this time. So, telehealth etiquette 101. So on the patient side of things, you really need to set some expectations around privacy, which again, for patients may be a little bit harder right now. You know, it's one thing when patients are typically home in their normal day-to-day lives, but right now a lot of people are working remotely, a lot of kids, most kids are out of school. So there's a lot more people likely to be in one's home at this time. So just figuring out where can the patient go where they can get some privacy, even if it means like locking themselves in the bathroom with their phone or whatever the case may be. Around that as well, you also just want to make sure that the patient has the appropriate technology to be able to do this. Do they have a smartphone, a computer, or an iPad or tablet that has these capabilities? If they're using their phone, asking them to set it down, because I've definitely had patients doing this number before, and it gets very disorienting when you're on the other side of things. What is appropriate attire? As I think all of us have been joking about, you know, basically there are no rules now. It's essentially like being at the airport with a combination of, while also being the week between New Year's and Christmas, except indefinitely. There are no rules. The rules have all gone out the window. That said, we work in psychiatry. We do not need to see our patients naked. So at least making sure that they're appropriately clothed, and just setting that as an expectation. Also setting expectations around interruptions or background noise, which again, you may just have to be a little bit more flexible right now with everyone being confined to their home with their roommates, significant others, children, pets, etc. And then a basic one, which hopefully is less of an issue at this time since people are supposed to be sheltering in place or in their houses a lot more. But obviously you don't want somebody driving while they are doing their telehealth appointment with you. As far as things to think about for your own space, so I am doing this in the space in my apartment where I typically do telehealth. So I have a background that still looks fairly professional and appropriate, but you want to think about, like, this isn't Mr. Rogers' fucking neighborhood. You don't want it to actually feel like your patients are coming into your living room. So you want it to look a little bit professional, even if you just have a blank wall in the background, making sure that you have appropriate lighting so that you can be seen. So you see this guy, you know, he's got the lighting behind him, which is actually probably not going to be great. You're going to want the lighting on the other side coming in. Thinking about privacy and distractions. So this is a place where HIPAA is not waived. You do need to make sure that you have a space in your home where you can maintain appropriate confidentiality for your patients, and also really think about distractions from things like the phone, pets, children. You've already seen that I'm breaking one of these rules because my cats have been in and out here. Typically, though, when I'm doing telehealth with a patient, I would lock my cats out. But they may be joining us for this because I figured that they could help demonstrate some of the don'ts around telehealth for me. And also thinking about attire. So I personally find this hilarious. However, you probably want to have pants on, as demonstrated by the fact that, you know, like, I've had somebody come to the door when I was in the middle of a telehealth session. Fun fact, plumber came and knocked on my door once. Had to get up and go answer it. You don't want this situation going on where, you know, I got shorts on, don't worry, fam. But it would be very awkward if I had to get up and leave the room and it looks like to a patient that I'm half naked. So something to consider. Another thing to consider is like where your phone is. I will keep my phone nearby because I sometimes need it during a session. Like, for example, if you do any remote prescribing that requires a dual authentication. For me, I have a lot of that where it requires a dual factor authentication, and I have to have my phone for that. But just making sure that you do set it aside and that you're not like checking things on your phone, and that you really are trying to maintain your presence with your patients. Some other things is thinking about things like food and drink. Probably don't want to be sitting here, you know, drinking your wine, eat your popcorn. It's good stuff, but again, probably not the most professional. Delicious, however. Other things to think about if you really want to make sure that you're focused on maintaining the therapeutic alliance. So first of all, just acknowledging the awkward. Acknowledging that if you are not somebody that's done telehealth before with your patients, this is their first time doing it, your first time doing it together, that it feels weird. It is different to see your provider over video when you're used to having, you know, I think especially as mental health professionals and certainly as, quote, regular health professionals, we're used to being in the same room with our patients. We are used to having that sense of being in the same space together. Certainly if you are not a mental health professional and you are another type of medical provider, often you're used to being able to touch your patients. So it is different and it feels kind of weird. I also think that just really acknowledging the awkwardness and the uncertainty just around the time we're living in right now. My hospital has officially said that this is the standard for the next 2 to 4 weeks. However, overall, what I'm hearing is that this is likely going to be how we're doing business for at least the next 3 months. So I think just acknowledging too that this is a really unprecedented situation globally and that we're all trying to adjust and change, but there's a lot of anxiety right now and it's scary for people in addition to this kind of feeling weird. Some other just like practical things to help with engagement is really thinking about where you're looking. So for example, right now I am mostly looking into my web camera. I am not looking at the place on the screen where the patient would be if I was actually seeing somebody right now. So that can feel a little bit weird. You know, as mental health professionals, we're really used to making eye contact. And in order to maintain the illusion of eye contact in this format, you usually do need to be looking at your camera versus looking at your screen, especially if you do have a bigger screen with like a web camera that sits on top. If you're looking at the screen, you're going to kind of be looking like this, and it's going to look strange to your patients. Another thing to consider is having some verbal cues around your workflow. So For example, when I do have that second screen up with the patient's chart, it's usually over to my right, and I'll just let the patient know at the beginning, hey, I just want to let you know that I have your chart up over here, so if you see my eyes darting over this way, that's what I'm taking a look at, just so that they know what you're doing and they don't think that you're like looking out the window or checking your email or looking at Facebook or whatever the case may be. And also just really having some mindfulness. I find that it actually requires a lot more work for me to stay engaged and to pay attention during telehealth. So really just checking yourself to try to be present in the moment. It may take a little bit of extra effort, especially as you're kind of getting used to it. But I do find that it takes some extra attention on my part to stay engaged and to not get distracted. What are just some useful nitty-gritty details? So a couple of things to just be aware of, and I'm sure that there's things that I'm leaving out here. For documentation, you do want to include something along the lines of this statement. The patient was seen over live interactive video conferencing and, quote, patient name has consented for live interactive video conferencing. The thing I took this from said that they had signed consent, but because your patients may be doing a verbal consent right now, I changed it for this purpose. And then also this sentence, I discussed the use of video conferencing with the patient, including alternative methods for meeting, the limits of confidentiality, and emergency procedures and resources. And then you want to put in where the patient is located and where you're located. So those are just some things that are usually required from a documentation standpoint, especially if you're billing insurance. If you're doing all private pay and you're not billing insurance, some of these things are going to be less relevant. For billing, you are going to use your same billing codes that you would always close out your visits with, except you are going to add a modifier, and that modifier is GT, which should pop up if you're doing in an EHR. What it stands for is interactive telecommunication. Why GT? I don't know, but that is the modifier that you will need to add. Otherwise, you're going to use the same codes that you would always use, whether it's E&M codes if you're a prescriber, or therapy codes, whatever it is that you're typically billing, but you're going to add a GT modifier. So just some of the nitty-gritty logistics to be aware of. And then finally, I just really want to say, telehealth is a really great way of providing continuity of care right now. I think it's great that we have this as an option so that we can continue to provide care to our patients during this really stressful and anxiety-provoking time for all of us. But certainly for those in the mental health world. Another thing is just, you can develop a process and then figure out what works and what doesn't, and you can refine it as you go. This is a big learning curve for a lot of people, and so I think just knowing that, do the best you can and try to plan ahead and think as many things through as possible. Stuff is going to come up that you forgot or that you find isn't really working, and as we move forward in time, you can change those things. So it's okay. You don't have to have it all completely figured out right this second. This is a learning curve. You will get better at it as you move forward. So you don't have to be an expert. And I think you can acknowledge to your patients, it's a very human thing to say, hey, this is new for me too. So we're going to kind of figure this out together. And then obviously pay attention to changing guidelines, such as how much wine should you be buying, depending on where you are in the country. But almost every day, the federal government is coming out with different guidelines and waiving different regulations around telehealth. One of the ones I didn't mention here is around licensing. So typically for telehealth, treatment takes place where the patient is located. And if you are seeing a patient, you need to be licensed in the state where the patient is, not necessarily in the state where you physically are. A lot of states are waiving that right now, so that's something, however, that is changing on a state-by-state basis based on whether or not states have declared a state of emergency. So it may just be worth looking at, especially if you have patients that for whatever reason are hunkering down, if you treat college kids and they had to go home, or you have patients who decided to go stay with their elderly parents, etc. So they may not actually be in the state where you would usually see them. It may just be worth taking a look at if the state where they are is one of the ones that has waived that guideline. And I will also include a link. This is a article that my colleagues and I wrote. Special shout out to Sarah Schwenk, who provided a lot of the tips in this particular video that I did, but this is a link that if you just have some more questions around telehealth and you want to know more about how to use it can be useful, as well as I think this article really also points out that patients, for the most part, still feel like they are able to maintain a strong therapeutic alliance using this technology. It's actually providers that tend to have a bigger problem with it. So our patients actually, we can still provide really good quality care. And that is all for today. If you have any questions, please feel free to shoot me a message and I will be happy to answer them or maybe address them in a follow-up. I appreciate everyone tuning in, and if you stuck with me this long, congratulations. Go pour yourself a glass of wine and hang in there, stay safe, stay healthy, make sure you're practicing good self-care.